Tuberculosis, once thought to be on the verge of eradication, is making a dangerous comeback. This resurgence is a significant threat to global health. The disease, also known as the White Plague, has plagued humanity for centuries. Now it is re-emerging as a significant threat, particularly with the rise of drug-resistant strains. Today we will delve into the reasons behind TB's resurgence and explore potential solutions to combat this growing health crisis. Tuberculosis is a serious infectious disease that primarily affects the lungs. Early diagnosis and treatment are crucial to prevent the spread of TB. Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. This bacterium spreads through microscopic droplets released into the air when an infected person coughs, sneezes, talks, or sings. When these droplets are inhaled by a healthy individual, the bacteria can lodge themselves in the lungs and begin to multiply. Once inside the lungs, TB bacteria can cause inflammation and damage. This leads to the classic symptoms of tuberculosis, such as persistent cough, chest pain, fatigue, weight loss, night sweats, and coughing up blood. If left untreated, TB can spread from the lungs to other parts of the body, including the kidneys, spine, and brain, leading to severe complications. Several factors contribute to the resurgence of tuberculosis. It is driven by a combination of biological evolution, socioeconomic disparities, healthcare system weaknesses, and global public health challenges. One major factor is the HIV/AIDS epidemic. HIV weakens the immune system, making people more susceptible to TB infection. The rise of multi-drug-resistant TB due to incomplete or improper treatment, misuse, and inadequate treatment of TB contribute to the development of drug-resistant strains, complicating treatment and prolonging its duration, and overcrowded living conditions, malnutrition, and inadequate healthcare systems also contribute to the spread of TB. These factors are often prevalent in low-income countries, making them particularly vulnerable to TB outbreaks. The rise in international travel and migration, particularly from regions with high TB prevalence, has contributed to the spread of the disease. The alarming rise of drug-resistant TB. Drug-resistant TB is a serious threat to global health. It occurs when TB bacteria mutate and become resistant to the drugs used to treat the disease. This resistance develops when medications are not taken properly or when treatment courses are not completed. This allows the bacteria to survive and multiply, making the infection much harder to treat. Multi-drug-resistant TB, often called MDR-TB, is resistant to at least two of the most potent first-line TB drugs. Extensively drug-resistant TB, known as XDRTB, is a rare type of TB that is resistant to almost all available TB drugs, making it extremely difficult and sometimes impossible to treat. Strategies for prevention and control. Despite the challenges, there are effective strategies to prevent and control TB. Early diagnosis and treatment. This involves identifying and treating infected individuals quickly to break the chain of transmission. Expanding access to rapid diagnostic tests and ensuring a consistent supply of effective TB medications are vital steps in this process. Strengthening public health systems and educating the public is essential to prevent and control TB effectively. This involves enhancing surveillance systems to monitor disease spread, implementing infection control measures in healthcare settings, and addressing social determinants of health, such as poverty and overcrowding. Ending the TB epidemic. A call for global action. The fight against TB requires a concerted global effort. Increased funding for TB research is crucial to develop new and more effective drugs, vaccines, and diagnostic tools. International collaboration is essential to share knowledge, resources, and best practices to combat this global health threat. Ending TB epidemic is achievable, but it requires extensive collaboration and working together. Like, subscribe, and turn on notifications for more insights.